Hi, this is Dr. Kate, and I wanted to do a podcast episode on, so you found out you're pregnant, what next? What are your options for what kind of birth care provider you're going to have and where you're going to deliver at? And I've had 2 kids, and I had different place for delivery for each. So I have experience with delivering in a hospital setting with a nurse midwife. I also labored with a lay midwife at my house ahead of time. And then with my second, I delivered with a nurse midwife in a birth center down in Pittsburgh. So you've found out you're pregnant and you've got to look at the different options. So essentially there are 3 options for where you can deliver. You can deliver in hospital setting, which is the most common, and you can deliver at a birth center. Birth centers are run by nurse midwives, and there's a difference between a nurse midwife and a lay midwife. Those are run usually by nurse midwives, and they have to follow some guidelines with where they're located and how close they are to a hospital with the ability to deliver babies. So they've got some regulations they have to work with. And then you can always deliver at home. And that would be, at least in Pennsylvania, that would be with a lay midwife. To my knowledge, nurse midwives are not allowed to deliver babies at home. So it would have to be a lay midwife. So I guess the first thing would be, what are the differences between the lay midwife and the nurse midwife? It would be their schooling and how they get their qualifications. So with a lay midwife, they do an apprenticeship, work under another lay midwife, and basically learn the trade. And that's how they've done it for, centuries. Midwives have been around forever, highly used all over the world. And just like with any profession, there are good and bad. The lay midwives that I know personally are phenomenal. Been in the bringing babies earthside for decades, and the one in particular that I know personally, I respect her a lot. She knows a lot about all things birth related, and is a phenomenal resource for both education and then delivery, prenatal care, postnatal. She actually helped me labor at home before I went to the hospital to deliver my daughter. And that was planned that way for a weird circumstance. But a nurse midwife has their bachelor's in nursing, and then they go on to become a nurse midwife. And actually my doula, who I interviewed on here a few weeks or months ago, is going on to school to become a nurse midwife. And they typically deliver in the birth center setting or in the hospital setting, and they work underneath an OB-GYN. The other option would be to use an OB-GYN. And I have had some care from an OB-GYN while pregnant with my first, but I only saw her a handful of times, and that was just to get accustomed to her, just in case something went wrong and I needed a C-section. She would have been the one to deliver for me. So I can't speak really. I'm not well versed in what that would have looked like had I delivered with the OB-GYN route. So if you are trying to make up your mind whether you want to do home or birth center or hospital, one thing the first thing to decide would be, in the home setting, in the birth center setting, you're not able to have an epidural. So you're not able to have an epidural or pain meds. At least at the birth center I was at. The birth center I was at with my son allowed nitrous to be used to help relax you and that sort of thing. I didn't use it. I had already delivered my daughter without anything, so I just didn't think I didn't think much about it. Once you kind of get in the zone, at least for myself, I was just really focused, and it didn't even occur to me to ask for it. I knew it was available. I just kind of forgot about it. So that's the only kind of extra measure that they can bring in there. And they also, I don't think, typically use Pitocin, which is something that they use to speed up your contractions and help induce labor at the birth center. They use it after delivery to help with any hemorrhaging and that kind of stuff because it contracts the uterus and helps with that. I didn't have that for either of my kids, but it was an option. So the big, decision point with whether or not you pick birth center, home, or hospital is if you feel like you want that option for epidural, or you want that option, then you would go to the hospital. With the birth center I was at, they have a close relationship with McGee Hospital, and that would have been where I would have delivered if anything had happened. And it wouldn't be as though if you don't just get transferred if you are, in a very dire situation. You could transfer if you thought, like, I just can't do this anymore. They would still transfer you, and you could, get to the Big E and have an epidural or pain meds or anything like that. So that would be the big difference between the two. We do have some local lay midwives here that actually deliver babies at their own house. I have never met them, but I have patients that use them and they love it. There's less mess for them at their home. It's set up this lay midwife's house is set up for that. So there's also that option I forgot to mention. And another thing to keep in mind is to always tour the area or the facility that you're considering, because they're not all identical. With both of my daughter's birth and my son's birth, I originally was supposed to deliver at a different birth center with my daughter, and it closed a couple weeks before I was due. So I just switched in a very short amount of time to a hospital to stay with my nurse midwife. But that birth center was very similar to the Pittsburgh birth center that I had my son at. Both lovely facilities, set up like with all the things that you would want for birth. Very nice, subtle lighting and comfortable decor, like a big king-size bed that you can rest in, labor in. After you have the baby, you can have, just a nice recovery time there. The baths, the tubs that you can labor in, which some hospitals have tubs that you can labor in, and you should definitely ask when you're touring it, because like with the birth center that I delivered at, you could deliver in the tub, and at least in my area, some hospitals do have tubs and you're allowed to labor in them, but you're not allowed to deliver in them. So that would be, something to ask if that's something you're interested in. I thought maybe I would want to deliver in a tub, and then when the time came, I was like, oh, no, this is not for me. So, everybody's different, and what you think in your mind might be exactly what you're looking for. You might get into the actual throes of things and realize that is not for you. So there's, checking out to see if they have a tub for laboring or a tub for birthing, seeing if they have squat bars. Most hospitals have squat bars. Our local hospital does not have squat bars. That, from a biomechanical standpoint, as a chiropractor, those are great to help you squat, shift the hips around, and get that movement of each side of the pelvis to help baby engage and make those maneuvers through the pelvis. If you don't have any options and your hospital doesn't have one, don't worry. You can always use your partner to kind of hang on and support you and do a similar kind of thing. The other thing to ask the different facilities, if you've decided you don't want to go the natural route and you want some intervention, you can ask the hospital you're at, do you have nitrous? Do you have the ability to do a walking epidural? So, there's different types of epidurals, and it's good to know ahead of time what your hospital can offer. So a walking epidural would allow you the ability to still get up and move around, so you have more mobility. Sometimes regular epidurals, you're, confined to the bed, you can't move much. There's some downsides to that, biomechanically speaking, for being able to shift around and help baby maneuver through the pelvis, because when you're lying on your back, you're not letting gravity do its thing, and you're also not able to open up the backside of the pelvis and let the tailbone drop down and open up the pelvic outlet as much as would be helpful. So those are some things to think about when you're in that process of deciding what looks best for you. Or, there are so many different options and so many different things that you can fine tune to what works best for you. And we had done an interview on a birth story months ago, and we talked about, being flexible, because, I didn't do an epidural, and there were reasons for that. I didn't want a badge of honor for just suffering through pain. I didn't want a C-section because it's major surgery. So I wanted to make that as far out as a possibility as possible. And there are some things with epidurals that make you more likely to have a C-section, and I didn't want that. So, and luckily, everything worked out for me, and I was able to deliver, no problem, no epidural. But if you're in so much pain and not able to relax, and sometimes that epidural can be the game changer to let you relax, let the pelvic floor relax, and let the baby come down and engage and deliver. So, don't try to be flexible with any birth plan, and just know that it's every baby you have is going to be different, and your experience will be different from your friends, your sisters, your whatever. So the other thing I would ask when you're, checking out different places to deliver would be, do you have rules about eating with the birth center and laboring at home? Typically, there's no issue with eating or drinking while you're laboring. It's my first midwife said, think of it as training for the biggest physical event of your life. And why wouldn't you fuel up and hydrate when you're doing a marathon? So birth centers and home births are fine with eating and drinking. Some hospitals have issue. It's come around, and drinking is usually fine in hospital settings, but sometimes they frown on eating. And that depends on the provider you have. So it's twofold: deciding where you want it to deliver at and who will be delivering, because that's going to be a game changer as well. So asking the food question and the drinking question, and asking how if they insist on you delivering on your back, or if you're allowed to deliver in other positions. I know for myself, for both delivering my son and my daughter, there's no way I would have been able to deliver lying on my back. I wasn't on my back the entire time with my son, not once. And I just didn't have them check my dilation. You don't really need to do that. And then with my daughter, they checked one time. I threw up everywhere. It was horribly painful. It was just not a good position for me. And I remember thinking, I don't know how my mom did this. She delivered both myself and my sister on her back, no meds, no epidural, and I think I would have probably died that way, just from my immediate pain from lying on my back. So for myself, it would have been a non-negotiable if I had gone to a hospital or provider that would have insisted on that. So that would be something to ask, and you never know until you get there. And just with how the outlet of our pelvis is shaped, and gravity, and having your tailbone scooped in and kind of in the way of delivering a baby, lying on your back really isn't the best way. And for some people, they deliver super easy on their back, and that is great. But if you don't, then you need to be able to move around and get into that optimal position. I had rather large babies. They both had 100th percentile heads. My son was over 10 pounds. I think I needed every little sliver of space to get his giant head out. So, that's another thing to keep in mind. Will the doctor or midwife work with you? Usually midwives are kind of like, I'll deliver a baby on the toilet. I'll deliver a baby wherever, squatting, anything like that. So it's something to ask. The other thing is, getting to know all the different doctors in a practice, because you're not just going to have one doctor that treats you the whole time and then delivers your baby. Like, they're humans too. They have to have coverage, and they cannot be available 24/7 of every day. So making sure that the other providers all align with how you see your ideal birth going. When I delivered with my first midwife and the OB-GYN she worked with, I liked her a lot. I asked her all these same questions. We're all on the same page. It was great. With my son, I actually followed that midwife to a different practice. And when I went, she said, we are short a staff person. You might get one of the doctors, not one of the midwives, if there isn't coverage, and you won't have the birth you want. And I was really thankful that she was so honest with me, and I really liked her, and I didn't want to deliver with someone else, but I didn't want to have a bad experience by not having one of the midwives that they had there. So I switched and went to a birth center down in Pittsburgh. So definitely something to ask about the stance of every doctor in the practice that you pick. Another thing is that, at least in Ohio, and I'm not sure, I didn't deliver in a hospital in Pennsylvania, but in the hospital in Ohio with my daughter, their rules are that once you hit a certain dilation, your nurse midwife is with you the whole time. So I really didn't have much experience with the nursing staff in the hospital, because the nurse midwife was there the whole time, because the lay midwife, that is one of my friends, waited and sent me to the hospital once I hit 7 centimeters. So I didn't have to wait to see my nurse midwife very long. And she probably, when you have a nurse midwife delivering your baby, they're there a lot. They're coaching you through the pushing phase and helping you get in different positions to help baby engage and get down lower. Doctors, as what I understand, I haven't had a birth with a doctor, but from what I understand, the nurses kind of take over that role and the doctor comes in when it's time to push. So it's a little bit different. And so then you have, do I have a good relationship with the nurses? And you're not going to interview nurses before you go to the hospital, but typically I know a lot of labor and delivery nurses, and they're all very passionate about what they do. And I think that most of them that you'll find are super intuitive as what people need. But if you have a certain type of birth in mind and they're used to epidurals or whatever, I would let them know ahead of time that you maybe, if you want the more natural path and you're doing it in the hospital, let them know so that they can be encouraging instead of just asking you constantly if you want meds or an epidural or that kind of thing. Because sometimes they're just used to that more medically driven birth process, just because that's what they see on more of a regular basis. When I had my daughter, the next day, the nurse asked me if I wanted paid meds, and I was like, paid meds? I just did the hard part without paid meds. I feel fantastic. I don't need pain meds now. But, and she was just kind of like, I don't understand what you mean you don't want pain meds. But, and I didn't have very much tearing, so I was lucky, very lucky in that way. But one way to make sure that you have that support system and help with getting into different positions that are beneficial, like the whole spinning babies concept, that's a great resource. I'll link it below. I use their stuff with my patients. That would be a great way to bring in a doula to your birth plan, and that can help you get the kind of birth you want in possibly the setting that's not your ideal. I had a doula for my son. She was fantastic. I interviewed her on here, so if you want to know anything about the doula stuff and what they do and that, you can listen to the interview with with Lily Carter. And she has a doula business in Pittsburgh. Doulas hold lots of different roles, whether it be prenatal, birth, or postpartum. I think it's a great addition to help with getting you the birth that you'd like. And actually, in my local area, we have a really cool program that I think it's the county has free doula services to the local community. And I think they have a certain amount that they can take on per so many months, but that might be available near you. So that is something to look into as well. And I knew one of the doulas that had done it, and she's not there anymore, but she, also very passionate about all things birth related and getting people, no judgment at what type of birth you want or anything like that, but helping people get educated and pick from a place of knowledge, rather than just kind of going along with the flow of things. Because really that's the most important part, is being as well versed and knowing all the different facets of it so that you can make the most educated and best decision for you and your family, because that's not going to be the same for each person and family. So that is our little spiel or to help you if you are newly pregnant and want to know what venue do I want to go in. Home, birth center, hospital, and whether it be with a nurse midwife or a lay midwife or a OB-GYN. So I hope that helps. Let me know if you have any questions. I'd be happy to answer them.